Good afternoon, folks. We're waiting and standing by for the Knox County Health Department to meet. Obviously, a big point of discussion today is the health board, or the Board of Health, rather. Last night, just to get everyone back up to speed, the Knox County Commission voted to take away power from the Knox County Board of Health. Now, that was the first reading. The second reading will take place January 25th. Again, we're standing by for the Board of Health to meet. It looks like the health department is about to meet right now. Dr. Martha Buchanan, who has been recovering from COVID, has just stepped up to the podium. We expect to hear something along the lines from her on benchmarks, where we stand in Knox County, and a little bit more information about what this potential Board of Health switch in power would mean for public safety and general health here in Knox County. I'm now going to toss it over to the Knox County Health Department meeting, where again, Dr. Martha Buchanan has just now stepped up.
Gratitude today is dedicated to our internal vaccine team. From the clinical folks who administer the vaccine to our logistics and operations team.
All right. Sounds good. Thanks, David.
Who ensure everything behind the scenes runs smoothly. We are grateful for their work that they have been doing over the past several weeks and months that have led us to today. Because we're happy to announce that we received our first shipment of Moderna COVID-19 vaccine this morning. It contained 2,200 doses. And I will show you a few pictures that our team took this morning when they were opening the box, which was an exciting event for us here at the health department. This is certainly a moment in history and one that represents hope and light at the end of the tunnel. This means a lot to all of us here at the Knox County Health Department. We know our work is far from over, but this is a positive step in the right direction and exciting opportunity for anybody who's in public health to get something that we know is a really effective prevention tool to make a difference in our community and over time turn the tide on COVID-19. The vaccine we received will be used to immunize priority groups that we are responsible for vaccinating as outlined by the Tennessee Department of Health's statewide plan, including our mass testing team. We have already begun the process of working with these groups to schedule clinics for them to receive the vaccine. And I know folks look at the priority groups and say, when am I going to be up? We will be communicating with various professional organizations and in different ways, getting the message out as we have to follow the prioritization as set by the Tennessee Department of Health, which is based on the CDC's guidance and based on risk stratification. Those folks who are more likely to get sick, or those folks who are more likely to have serious complications if they do get COVID. So again, we'll be following those and trying to keep you up to date as often as we can and just moving through those phases as we get vaccine and as we are able. Regarding media coverage, we will be sending out a media advisory this afternoon with information on an opportunity today for our media colleagues to get photos and or video of priority group members getting the vaccine. As a reminder, we do not expect this first batch of vaccine to be enough for us to vaccinate everyone, even in that first priority phase that we are responsible for vaccinating. We will continue to vaccinate within this phase as we receive more shipments. And it's a little bit confusing. Phase 1A, I think that's what it's called now, includes some folks that we, public health, are responsible for vaccinating, but then also the hospital staff that the hospitals are vaccinating. So vaccine and long-term care, which will be vaccinated through various ways, either through CVS and Walgreens, or some of those long-term care folks will be vaccinated by public health as well. That said, it will be a while until the vaccine is widely available for anyone to receive it in our community. So we ask your patience once again, because this process will take some time. We remain encouraged by the news from the scientific community illustrating the safety and effectiveness of this vaccine. We urge everyone to take this opportunity to research and make an informed decision regarding whether you get the vaccine or not. Be aware that there is a massive amount of misinformation online and on social media. So make sure you're looking at trusted sources for your research. These sources include the CDC, the Tennessee Department of Health, us here at KCHD, Johns Hopkins, Mayo Clinic, and your medical provider. So go to those trusted sources to get information as you make decisions for yourself and your family about COVID-19 vaccine. We will now move to the local situation. We have 478 new confirmed cases since yesterday's report. We have 5,152 active cases. 150 Knox County residents are currently hospitalized. And sadly, we have 6 additional deaths to report today, raising our total to 272. I will now open it up for questions.
All right, the first question we have from the media partners in the chat room is from Alan Sims with Inside Knoxville. He asks, do we have an update on how many people in Knox County have been vaccinated, and will there be a running count provided on the website?
So the Tennessee Department of Health has a dashboard to inform people about vaccine, how much is going out and what's being given. And I believe it's broken down to the county level, or is it, or regional level? We'll have to look at that, but that's going to be available on the Tennessee Department of Health website.
The next question we have is from Cole with WBIR. He says, welcome back, Dr. B. We're glad to see you. Many people here in Knoxville have not had COVID-19 or know anyone who has had it. How are you feeling now, and what was it like?
I'm feeling much better, thank you. I honestly had a mild case of COVID, so it just felt like I had a really bad cold for a few days, and I had a little bit of fatigue. But I know folks, I mean, just like any virus, it's a wide range. Some folks, when they get the flu, aren't as sick as others. Some folks require hospitalization, and I'm very grateful that I had a mild case, but I know there are folks out there who are struggling, who have more severe cases, and even folks who end up in the hospital. And as you know, as we know, folks who die from COVID. So grateful for a mild case and grateful to be back at work.
Next question from Austin with WATE. Can you give us the total death toll for December? Sorry.
We'll have to pull
that's something we can go back and get to you after the briefing. And I just want to make a distinction too, that the information we report out each day is the deaths we're reporting for that day, but the date of death chart is available on our website under the 5th benchmark. From Cole with WBIR, so many folks at KCHD have worked so hard for so long. How did it feel to see the vaccine arrive today?
It was pretty exciting. I wasn't actually physically there, but I got an immediate text that the vaccine was here, and then a flurry of texts after that. So everybody's very excited. You know, the thing, we know vaccine. We at Knox County Health Department, our team does our school flu clinics every year. We're very proficient at it, and our team is very good at getting vaccine out there and making sure everybody has an opportunity to be vaccinated. So we're excited about this opportunity. I don't want this, though, to say everybody to go, oh, we don't have to do anything anymore. We still have to follow the 5 core actions. It's so important. It's really important that we don't let our guard down until we have adequate vaccine and adequate numbers of people vaccinated. And then we'll be able to start getting back to more pre-pandemic normal.
From Austin with WATE, what does the health department think about moving one step closer now to its director solely shouldering the responsibility of public health decisions and regulations in Knox County?
Well, I don't know what the health department thinks, but I know what I think. So, you know, I am here to serve this community and to make those tough decisions. I've made those decisions before, and I'll make them again. I hope that we keep the Board of Health. I would prefer to keep the Board of Health as it is, but if that's not a possibility, I hope that we keep them as an advisory group. It's nice to have that group of trusted experts to weigh in on the decisions so that, you know, as a sounding board, even now, that's kind of how it works. And ultimately, that we all make that decision, we make our votes. But I'm here to serve and continue to make the right decisions and provide the best guidance, make the best decisions I can based on my public health expertise, based on what my public health experts that work with me advise, and based on what the state and CDC are advising. So it's not easy, but I'm willing to do that, and we'll continue to serve this community and continue to make good decisions.
From Sam with WVLT, with the county commission's vote last night, what do you think a change in power from the Board of Health would do for public health in Knox County?
You know, I don't think that it'll change public health in Knox County. If you look at my track record, I have voted in concert with the Board of Health on every vote. I've been in favor of the things that we've done. And as I said before, even before the Board of Health was making those decisions, working with our law department, I put some orders in place early on that helped keep our counts down and helped us be able to get some things in place before our cases went up.
From Brian Hornback, at last night's commission meeting, comments were made that there were concerns about you handling the responsibility for handling the decisions. You've been a voting member of the Board of Health. Are you concerned about being the sole decider of the commission's approval on second reading?
I'm totally willing to continue making these tough decisions and making choices. I think we need to stop focusing on who's making the decisions and refocus on what do we need to do as a community to turn the tide on COVID. It doesn't matter who's making the decisions. The things that need to be done are obvious. We all need to practice the 5 core actions all the time. We need to limit our social interactions. That's how we're going to turn the tide on COVID. Whoever's making the decisions, they'll make those decisions. But the science of the virus doesn't change. The fact that the virus is in our community doesn't change. And what we all need to do to decrease our risk and the risk of those around us doesn't change. It doesn't matter who's making those decisions. Again, social distancing is very important with this virus. Wearing a mask when you're out or in your house if you have people there that aren't from your household. Washing your hands regularly, staying home if you're sick, and cleaning surfaces regularly. And when it's available, get vaccinated.
Austin with WAT is asking when the first vaccines received today will be administered and who will they go to. And Austin, we will be sending out a media advisory shortly after this briefing with more information on how the media can cover today's event. From Vincent with the Sentinel, will KCHD put out calls to new prioritization groups as new groups move to the front of the line for vaccinations?
Yes, our team is working on, we already have relationships with a lot of these groups that are in these priority groups. So it's not that big a leap for us to work with them to get their staff and or residents vaccinated. We're already working, thinking about phase 1A, 2, or what, I can't remember all the numbers, but thinking about the phases going forward and how we'll do that. So we'll be communicating directly. A lot of that will be through employers. And then we'll spread that out as we're able to.
From Cole with WBIR, have you seen a noticeable increase in people coming by to get tested before Christmas?
Our numbers have been up, even since Thanksgiving. I think our numbers have stayed up. And we're testing, I'm looking at Charity. Do you know, estimate?
Over 400 a day.
About 400 or more a day, pretty consistently over the last few weeks.
From Sam with WVLT, you've said that you have backed the decisions from the Board of Health. If you feel nothing would change in public health, what should change in the immediate future to improve the case numbers?
People need to practice the 5 core actions consistently. All of us have to do our part to be part of prevention. And we need to all focus on practicing the 5 core actions, not having social gatherings. I know it's Christmas, I know it's New Year's, and nobody wants to hear that. But the truth is, our system can't tolerate a spike like we had after Thanksgiving. And so we need to be creative. All of you need to be creative on how can you celebrate with your family and make it meaningful. I heard somebody today who sent her mom a care package so that when they have their, whatever they're going to have Christmas morning that's virtual, they'll have food to eat and they can share a food that way. That's a creative thing to do. I've been sending my dad packages. So be creative, come up with ways to make it meaningful, and you might come up with a new tradition. But you also create memories. And so you can think back and remember 2020 when we had to do that at Christmas, and it'll be one of those family lures that hangs around forever.
From Cole with WBIR, what could happen to our community if people celebrate Christmas as normal this year?
Well, we'll see what happened, exactly what happened after Thanksgiving. So we're already up there 400 or 500 cases a day. We'll see that go up to 700 or 800 cases a day, and our hospitalizations will go up and our deaths will go up. Right now, we're averaging 3 to 4 deaths every day of a Knox County in. We don't want that number to get higher. Tennessee is the epicenter of this outbreak right now, and Knox County is the epicenter within Tennessee. That's not a good place to be. And if people pretend like the virus doesn't exist and decide to have Christmas as usual, then they are putting themselves and presumably people they care for at risk of getting ill and maybe even having to go to the hospital and maybe even passing away. And that's not a Christmas gift you want to give somebody. you want to be creative and make some sacrifices. I know we've asked a lot of our community to make sacrifices throughout the year, but it is vitally important that we do not gather with people outside our households for Christmas or New Year's. And so we are all in this together, and we all have to make these sacrifices.
Also from Cole with WBIR, statewide, we understand health departments are going to transition to self-test kits and more limited hours for COVID-19 testing. Does KCHD plan to do this? We don't have access to the self-test kits the state is getting. So we will be we're changing our hours. So on the days that we're vaccinating, because the same people vaccinate as test. So on the days we're vaccinating, we won't be testing. And on the days that we're here testing, our hours will be different. And I don't remember exactly what it is. We have that on our website.
Okay,
that is posted on our testing page to our website. From Vincent with the Sentinel, what do you make of the repeated arguments over who makes the decisions regarding COVID response? Are they a distraction?
They really are. They're a distraction to what's important. And what's important is all of us coming together as a community, our leaders coming together behind the 5 core actions and really putting it out there. And all of us putting it out there and, wearing our mask and social distancing and not gathering and making smart decisions throughout the holidays so that we don't see the increase in cases after Christmas and New Year's that we saw after Thanksgiving. We are so close. You can almost see the light at the end of the tunnel with vaccine arriving in Knox County. It's really exciting. Almost there. If we can keep up our guard and we can keep doing these things and step it up a little bit, be more thoughtful. I know as cases have gone up, I hear people talking about being more thoughtful and changing their behaviors now. And that's important. We all need to continue to do that. So stay the course and just don't get distracted by all the other stuff. Stay the course. What's important is preventing disease.
Vincent asking for clarification on which vaccine we got. And Vincent, we received at the health department, the Knox County Health Department received the Moderna vaccine today. Brian Hornback asks, how did Tennessee get into the #1 status? Is it the tourists coming into the area? Because when and where I am, masks being worn, but I'm not everywhere, obviously.
So I think the way we ended up being in the situation we're in is a couple of things. One is we don't have a consistent message from the state down on mask wearing or any direct message from our state leadership about mask wearing or even a statewide mandate. We know that in states where they have statewide mandates, disease levels are lower. And so it's inconsistent across the state. Wearing masks, not wearing masks, social distancing, what they're doing in beauty shops and what they're doing in different places is varied across the state. So without consistency, our numbers are going up. And yes, traveling and social gatherings back and forth do increase our risk of getting disease. And that's why we urge everybody to gather only with people from their household and to just make the smart choices this year. Next Christmas, we'll probably be able to be back to Christmas as usual.
From Sam with WVLT, has there been any consideration from you to decline taking over authority from the Board of Health?
This is it's my job, it's my calling, it's what I do. I am your health officer and intend to stay your health officer. Has it been hard? And have there been times when I'm like, maybe I could do something else that's not as stressful? That, yes, I've had those thoughts, but I'm committed to this community. I'm committed to seeing this through.
Any further questions, please go ahead and submit them now. All right, not seeing any other questions come in, so we want to thank you all for your time today, and we will be sending out that media advisory later this afternoon. We hope you have a good and safe rest of your day and a safe holiday.